are the early signs of COVID? For instance, if I have a dull headache, or if I'm, suddenly coughing a bit or sneezing because it's a weather change, do I need to worry that it could well be COVID?
No, I don't think so. Unless you have a household member with COVID, just a little dull headache, a little sneeze shouldn't worry you. I think if these symptoms persist and they are uncharacteristic of your routine, for instance, someone who gets headaches very often whenever they're stressed or watching too much television or spending a lot of time on a laptop, I think those headaches I wouldn't worry about too much. But the moment it gets more than usual and not something the patient is actually comfortable with, that's the time to probably be a little more alert. Or a cold that lasts a little longer. Actually, a cold is not a common symptom of COVID, Pradyuman. Runny nose that we see in seasonal flu is very rare in COVID. What you see in COVID is a sore throat, and we see fever, and we see headaches. And headaches actually come on in COVID a little later. So it usually starts off with the fever and the sore throat and cough. And then we've noticed the weakness sets in when the myalgia and the muscle aches start. And after that, of course, after day 5, day 6, breathlessness in a small percentage of patients. So the symptoms are not that of a typical cold. What mimics the typical cold is the fatigue, but the fatigue is almost 4 or 5 times more than classical seasonal influenza. So we need to understand that differential. Runny nose is not common, and the loss of smell and taste is not as common in seasonal flu as it is in COVID. So that's a big difference between COVID and seasonal flu. In fact, in the initial part of the pandemic in the UK, they were treating patients only based on sore throat, fever, and a loss of smell or taste without even a swab. So when I say treating, when they would do a research study, they would just use those criteria, do the swab later, treat early. And that's how an inhaled steroid trial actually made the headlines based on that research.
So you mentioned that if it's more than just a dull headache and it's going on for a while, fever, right, these are early signs. What is the oxygen level that you would think is a scary 94 a scary thing? Is it under 90 that one should be worried about? What is it that?
So it's important to understand that if you are living at sea level, which is say Mumbai, where I live and many people in India live, then above 95% is usually a normal oxygen saturation. And I think that is not written in stone, Pradyuman. If you're obese and you lie down and you have a big paunch, that paunch is going to push on your lung and drop that saturation to 94, 93, even during normal days. So I've seen people get panicked, or panic when they see a 94, 93 when they lie down. And if they're overweight, that's pretty normal. If they have sleep apnea, for instance, it tends to go a percentage or 2 points down when they lie down. And when they snore, even lower. But that's because they're snoring and their upper airway is closing. It's not because of COVID pneumonia. So at sea level, I would look at 95%. And consistently going below 95, and if people have been checking their saturation periodically, they would have a rough idea of where their normal saturations are. So consistently going 2 or 3 points below that, I think is something to be concerned about. Also, a little walk test, which I'm sure many doctors have now been advising them, which we've been used to walk tests pre-COVID pandemic, Pradyuman, because it's a standard test for respiratory lung function. And a 3 percentage point reduction in your saturation after a walk. So if you're saturating at 96 and after a 5 to 6 minute walk, you go down to 93 or below, that's a concern. Normally, our saturation should go up after walking because we are upright, lungs are better expanded, carrying in more oxygen to our blood. So a drop and consistent. And I always mention here consistent because we've had patients who mail us in panic, suddenly 192 reading. And I say, look, 192, the finger's a little bit cold, the circulation is bad, you can get a 90, 91. So just rub your palms together, warm the fingers so that the circulation is better, recheck the saturation. And that's the accurate one.
And since a fair number of people would have bought the oximeter a year back,
yes,
is it a wise thing to buy a new one after a year, or
if you're getting faulty readings, because many of these pulse oximeters they're good, they're pretty good, they're made in Taiwan and China at a low cost. They're not too bad, Pradyuman, but I think if it's gone on for a year and you're seeing some faulty readings, you may want to buy a second one. Okay, there are some, of course, very good brands which last 2-3 years. One made by a company called Nonin, American company. It's a bit more expensive though. It's about 8,000 to 10,000 rupees. But by and large, the other ones work equally well. So I think a change after a year is very good, but if you can use it for longer than a year as well.